welcome. Please come on in and let's have a chit chat. I'd love for you to introduce yourself.
Okay. Well, I'm Dr. Risa Kagan. Please call me Risa or whatever you'd like to call me. I'm very comfortable with that. And I've been practicing menopausal medicine for over 40 years. I was having babies and delivering babies. I'm an board certified OBGYN. And I then stopped practicing my obstetrics because of raising kids and trying to do it all and being married to the cardiologist. And and then I started getting very involved in midlife and beyond, but a long time ago. And right now, I always just say we've been trying to bring it out of the closet forever. I'm a clinical professor at the university here in San Francisco and teach medical students, residents forever. I also am a practicing gynecologist for many years. I did clinical research and did a lot of clinical research in menopause, hot flashes, sexual functioning, bone health. I was a co-medical director of an osteoporosis foundation. And now I am winding down, but I'm doing a lot of teaching, continuing medical education, like here, consumer education, as well as really trying to get the word out about what we call evidence-based medicine, like what is accurate, because there's a lot of junk out there on the social media and the internet. So I'm delighted that we're doing this here this evening.
Well, me too. And this session was developed by Vindico Medical Education with educational grant support from Astellas and Pfizer. And there's more project information in my link. Well, I'm really excited. I was just telling the people that I have just turned 49 and I was at TJ Maxx this week. This is a very short story. I was at TJ Maxx this week and I saw these things and they were cooling pads like for your pet in the summer.
Right.
And I was like, should I buy one of those for my bed? And then I was like, no, I cannot buy that. The hot flashes.
Well,
okay,
the
let's talk about menopause. What is menopause? Because I'm just learning about this.
Okay. Well, menopause is a retrospective diagnosis. People can't believe it, but it is something where you look back and say, oh, that was my final menstrual period 12 months ago. Okay. So it is something that is looked at and defined. When people say, when was your menopause? It really is something where it's your final natural menstrual cycle, not abnormal bleeding, that occurred about 12 months ago. So when you are 1 year without having a period, you are then called postmenopausal.
I thought that was menopause.
No, the time leading up to that. Okay.
So what's perimenopause?
Well, that's just it. We have a beautiful chart when I give lectures. It's the stages of reproductive aging. When puberty, you have your menarche, your period, you have your years, hopefully with regular cycles, and then you basically go through your reproductive years if you choose to have children. And then, the average age of where a woman starts having a lower level of estrogen and stops having menstruation is 51. Well, it can vary from like 40 to 58. So everybody's different. Now, when somebody has that final menstrual period between 45 and 58, that's considered normal, like the average. Okay. But there are women who go through this between 40 and 45 with their final menstrual period, which is, considered early menopause. And then there's a whole host of women who unfortunately do suffer from something called premature menopause under the age of 40, even 25, 30. That's a whole nother discussion, another episode, okay? But the perimenopause, the late perimenopause, is defined as when your menstruation starts becoming more irregular, it's not as consistent. And if have you skipped 2 months? Like when people...
Yeah, I have a period basically every 8 months. It's like a, you thought I was gone, I'm back.
You're back. Okay. And there are a lot of other reasons why women go a long time without a period. So it's not just perimenopause and menopause. Okay.
No.
There are some other hormonal factors that can cause that. But if you are, you're 49, you're having your regular periods over the last few years, when was the last time you had pretty regular periods? That would be the bigger question. Because probably as you started changing,
it's been a while.
You're fluctuating, estrogen levels coming from the ovaries, okay,
Oh,
and fluctuating hormone levels, but you can be really kind of out of whack for months, and then all of a sudden have lots of symptoms, and then all of a sudden things go back to being normal for a while. And so really a good menstrual history is what we really need to have, because people always want hormone tests. I want my hormones checked. I want my hormones checked. In reality, the hormonal levels are not that helpful for us
oh,
in to help women figure out what is going on. We take a good menstrual history if you're having periods,
right.
you know.
So I have a question. At what point are the symptoms the worst in the process?
Well, that's also highly variable. There's a huge study called the Study of Women Across the Nation, which finally has given us a lot of information. We used to think that the worst was before, during, and after that final menstrual period, and it lasted for 2 to 3 years. Well, we've now learned that some women can start having symptoms prior to that final menstrual period. And we learned from this SWAN study that if you are having menstrual irregularities and lots of horrible hot flashes, and you can't sleep, having all those symptoms years even before that final menstrual period, sometimes those women suffer the longest. There's also a ethnic and racial variability we learned from SWAN, in
Oh,
that median duration of hot flashes can occur for about 7.4 years for the whole cohort of women. But this study confirmed what we always knew clinically, which was that African American Black women have longest and the worst and the hardest hot flashes. The median can be even 10.1 years. That means 20 years some women suffer. Hispanic women now, okay, something like the
wow.
median being about 8 years. And then, you know, Caucasian women, white women, about 6.4 years. But that's the median, that's the middle. So it can be longer or shorter,
Right.
okay?
Oh,
But
who knew that?
it does peak the worst around before, during, and after the first 2 years after that final menstrual period. And then they gradually can get less intense and less frequent. But for some women, they can suffer for 14, 15, 20 years. So this is not something to just ignore.
Well, Risa, this is not boding well for me. I have a senior in high school and a third grader. This is going to be the struggle bus for a while.
Very
What,
flat.
what's, what symptoms do I need to be ready for? What are the most common symptoms?
Well, the most common symptom in this age group, and when you're going through fluctuating hormones, are hot flashes. Some people call it night sweats when they happen at night, hot flushes, hot flashes. The proper medical terminology, which you may hear about now because they talk about it on TV, is called vasomotor symptoms.
Oh,
So VMS, that's the word we call it now, VMS, having VMS, hot flashes. The next most common, and along with that, women have mood changes and they can have sleep disturbance. Some women have sleep disturbance in this time period not related to even hot flashes. There are some women that are just, you know, wired. There are many women who go through, for the first time in their life, they never had anxiety and depression. And then all of a sudden, around that final menstrual period, before, during, and after, they start having symptoms of being moody and depressed and unhappy. Fortunately, that will get better. And we do have good treatments for all of this.
right.
But probably one of the most important symptoms to tell our people who are listening here is, let's not forget about the good old vagina, okay? There is something called genitourinary syndrome of menopause,
Mm-hmm.
GM, that's the terminology we use, where along with the lower levels of estrogen, it often peaks years after that final menstrual period, but it can occur earlier as well. Women can describe for the first time, I want women to be aware of this, dry vagina, painful sex. They may feel like they have to pee all the time, or all of a sudden they start having frequent urinary tract infections. And we have really good, safe treatment options for that. So it's called GSM, okay? Genitourinary syndrome of menopause. Genitourinary, meaning it's involving, there's estrogen receptors in the bladder, the urethra, and the vagina.
So I thought that me having to pee all the time, I was blaming that on my 4 children that, smushed my bladder. So I'm really glad to know that. Now, you said
that
there's treatment. What can
women
help with the symptoms?
have that as well. Yeah, go ahead.
What can help with the symptoms? You said there is treatment. What can
The
help?
hallmark of menopause being hot flashes, if you do not have contraindication to estrogen, there is what we call hormone therapy. And if you have a uterus, you need to be taking, we have lower doses, we have different delivery systems, completely from what our grandmothers took, or years ago when people got scared of hormone therapy based on a lot of these big studies. But lower doses of estrogen this is the most effective treatment for hot flashes. And we have local forms of products for the vagina if you're not having the bad hot flashes, that are extremely safe and effective and have been tested. Now, not everybody can take estrogen therapy. And if you have a uterus, you must take it with a second hormone to protect you from getting a buildup of the lining. So we use a hormone called progestogen or progesterone.
Okay.
Or one other alternative with an anti-estrogen, okay, that combines it to protect the lining of the uterus. But there are women who have breast cancer, who have had uterine cancer, blood clots, who've had a stroke, and they can't take estrogen. For those women, okay, we do have many alternatives, and we recently had approved a new product. And the new product that was approved is called Veoza, and it works in the brain, the hypothalamus, in that brain area, the heat temperature area, and it can reduce hot flashes as well. And then we have a bunch of other, we use those drugs like the SSRIs and SNRIs, which are, people say, oh, they're an antidepressant, anti-anxiety med. But in reality, they work on the nervous system. So we use lower doses, and they're highly effective as well. Women should not suffer from hot flashes.
Now, so what you're describing, would those fall under the table of non-hormonal therapies?
That's called non-hormonal therapies. Okay. That's true. And people are looking for something over at Whole Foods, or they're always looking for the non-prescription non-hormonal therapies. And unfortunately, there are not that many that really, when it comes to looking at that versus the dummy pill placebo, that are very effective. I'll tell you some things that work. Cognitive behavioral therapy, weight loss. Yeah, there are some non-hormonal, non-pharmaceutical ways to treat hot flashes, but
exercise
has been looked at, and it's mostly makes you feel better, but it doesn't necessarily reduce the number and frequency and hot flashes. So, but I always tell people exercise. Reason mentally, it makes you feel better, gets rid of stress, and of course, cardiovascular in your bones, all the other reasons.
Right. Where can women go for more support before we head over to Candy Calderon's page?
Well, I'd like to really finish up by telling everybody there's so much out there, and I'm not on that, TikTok and all that, but there's so much out there, and the most accurate evidence-based information that you could get is at www.menopause.org. I've been on the board of trustees, I've been doing this, involved with them for years.
Right.
Really great consumer education. There are videos. We have something called Notes. It's the Menopause Society website. It used to be called the North American Menopause Society. We've now changed the term, we've rebranded, and now it's called the Menopause Society. So,
that's awesome.
www.menopause.org. It talks a lot about all these things we're talking about. But the main message here is you should not be suffering. You should not be suffering in silence. And if you can't find a practitioner to help you, you go to that website, you put in your zip code and how many miles you're willing to travel. And many do video visits now.
Right.
And you can find a certified practitioner. I actually took the first exam about, 30 years ago, and get recertified, certified practitioner in menopausal medicine.
Well, That is really great. And you're getting ready. You're going to go to a couple more pages. Next is Candy Calderon, and they're going to be talking about perimenopause a little more and these kind of misconceptions and the cognitive function. And you're going to really kind of delve into this ethnicity portion a bit too,
I think.
which is going to be great. So thank you. So nice to
Well,
see you. I could sit here all day.
Thank you very much for doing this and everybody who's attending, because we really need to get the word out there
Oh,
and accurate information.